Well, we know that COVID has been very much like flu and RSV in that it's had a autumn and winter peak, but also we're seeing that it actually has started to have a summer peak, that ever since the summer of 2020, you see a COVID peak during July and August. And that's because as it gets really hot in the US, people spend more time indoors in air conditioning, which increases their risk. They're also traveling more, which increases their risk. So I think we can expect to see this for the future, that we'll have this dual season peak of COVID. And also compared to RSV and influenza, COVID has a higher baseline prevalence, as one of the speakers indicated. So there's more COVID around in general throughout the year than influenza and RSV. Pfizer's new vaccine is going to be available most likely by the end of the month, and the other vaccines probably will be available in September. So, for people considering whether to get it now or waiting a couple of weeks, it might be worth it to mask up, wait a couple of weeks, and get the new vaccines. But that's a decision for everybody to make on an individual basis. But there is a concern, as some people have been indicating, that there's this collective amnesia that Americans and others have been forgetting about how bad COVID was. There's also a fatigue as well. And so it is really concerning because you don't see people masking, you don't see people doing proper hand hygiene. So I think as we go back to school in the next couple of weeks, we can expect to see a lot more COVID as well.